Have you ever opened a medical bill and just stared at it, completely baffled? It feels like trying to solve a puzzle, right? There are all these different numbers, and you're left wondering, what did this actually cost? Well, today we are going to crack that code together. Let's figure out why one single medical service can have so many different price tags. So let's just imagine for a second. You go to a clinic, you get a procedure done, and a few weeks later, that envelope arrives in the mail. You open it, and the big question just jumps off the page. What is the real cost here? As you're about to see, the answer is way more complicated than you'd think. Let's start by looking at the numbers. Okay, first up, you see this big, bold number right at the top, $550. This is the official list price. You can think of it as the sticker price that the hospital or clinic puts on that service. Seems pretty straightforward, right?
But then, wait a minute, you look a little closer and you see another number. Your insurance company didn't pay that full $550. Nope, they paid $440. That's the price they negotiated. So, is that the real cost? We're getting warmer, but we're not quite there yet.
And now get ready for the number that makes you question everything. $75. That's what it actually cost the hospital, in terms of supplies, the doctor's time, all the resources to give you that care. So how on earth can one service cost $550, $440, and $75 all at the same time? It feels like some kind of magic trick. Well, the secret to unraveling this whole mess isn't about complicated math. It all comes down to one very simple question. Who's asking? See, the price of healthcare isn't some fixed, solid number. It completely changes depending on your point of view. And that brings us to the absolute core concept for today's explainer. Perspective. If you really want to understand costs in healthcare, you first have to know whose eyes you're looking through. So what do we mean when we say perspective? It's just the viewpoint that determines which costs actually matter. Think about it. The cost to the hospital is totally different from the cost to your insurance company. And that's different from the cost to you, the patient. You're all looking at the exact same event, but you're seeing completely different numbers because you all care about different parts of the equation. In the world of healthcare economics, we can pretty much boil it down to 4 key perspectives. You can think of them as the main characters in our story. First, you've got the provider. That's the hospital or clinic doing the actual medical work. Then there's the payer, which is usually your insurance company. Of course, there's you, the patient. And finally, there's the societal perspective, which is like zooming all the way out to see the biggest picture possible. And this is where it gets really interesting. Just look at the difference in scope. A provider, like a hospital, has this super narrow focus. All they care about is, what did it cost us to provide this one service? But the societal perspective? Whoa, that's the wide-angle lens. It doesn't just include the hospital's cost and the insurance payment. It also counts your out-of-pocket expenses, the gas money it took to get to the appointment, and even the value of the wages you lost because you had to take a day off work. It is the true total cost to everyone involved. Okay, so now that we have a handle on this whole idea of perspective, let's connect it back to those confusing words you see on your bill. This is where we finally figure out the huge difference between a cost and a charge. This sentence right here, this is it. This is probably the single most important thing to understand about medical billing. The price, the amount they charge you, is not the same thing as the cost of providing the service. They are 2 totally different ideas, and when we mix them up, that's where all the confusion starts. Think of it like this, a journey in 4 steps. It all starts with the actual cost. That's our tiny $75 number. Then, the hospital tacks on its markup and sets a standard charge, or list price. That's our big $550 number. Next, the insurance company looks at that and decides on an allowable charge, which is what they think is a fair price. And finally, the insurer actually pays the reimbursed amount, our $440 number. Each step is a different financial reality for a different player in the game. All right, time for a quick but really important detour. It's not just who is asking that matters. It's also when they're asking. Because, money changes over time. This is all about the time value of money. I mean, we all know this intuitively, right? $100 10 years ago could buy you a lot more than $100 can today. That's inflation. So when economists want to compare healthcare costs over several years, they can't just look at the raw numbers. It wouldn't be a fair apples-to-apples comparison. For example, let's say a procedure cost $80 10 years ago. Well, in today's money, that's actually equivalent to something like $105. To make a fair comparison, you have to adjust that old cost so it reflects its value today. And there's a technical term for this process. It's called standardization. It's basically the tool that analysts use to level the playing field and make sure they're comparing costs fairly across different time periods. It's a critical step in any long-term study of healthcare. Okay, we've covered perspective, we've untangled cost versus charge, and we've even talked about the wrinkle of time. Now it's time to put all of these pieces together and finally solve our original mystery. What do those three different prices actually mean? And here it is, the grand reveal, all laid out. That shocking $550 number, that's the standard charge, the cost from the patient's initial perspective. The $440, that's the reimbursed amount, the cost from the insurance company's perspective. And that tiny $75, that's the actual cost, the cost from the provider's perspective. It's not a mystery at all. It's just three different numbers for three different viewpoints, telling three different stories. So the single biggest takeaway is this. There is no single, true, objective cost for a medical service. It just doesn't exist. There are only different costs, seen from different points of view. The number literally changes depending on who you are. And that leaves us with a much, much bigger question, doesn't it? If every cost is just a matter of perspective, in the huge ongoing debate about healthcare spending and affordability, whose perspective should we, as a society, care about the most? That is the real puzzle we need to solve.